Hello, my name's Sarah Carr and I'm a vet based in Monmouthshire, and I'm here at Abbey Equine Clinic in Abergavenny today to talk to you about how the Arwein DGC Equine Health Clinics can benefit you and your clients. Antimicrobial resistance is a priority of the Welsh Government, and I'm on the AMR delivery group of the Welsh Government, and we have a 5-year implementation plan to combat the development of antimicrobial resistance. Part of that plan involves setting up the Arwein DGC project, which is a collaboration between several partnership organisations aiming to promote the responsible use of antimicrobials. In 2019, 1.27 million people died due to multiply resistant infections, which demonstrates how we all need to do our bit in order to combat this problem. To this end, Arwein DGC is offering vets who treat horses an opportunity to do some one-to-one health planning with your clients with the aim of improving equine health and helping to reduce the use of antimicrobials. The clinics are fully funded up to a maximum of £250 by the Welsh Government. It's easy to register your client onto the clinic. They just need to live in Wales and be a horse owner. You can go onto the Arwein DGC website and you'll find the email address there, and you just need to register your interest with the email address with your client's name, address and contact number and email. And then you will receive a purchase order confirmation, and it's important that you don't do the clinic till you receive that. Once you've received it, you've got 30 days to complete the clinic. After completion, you just need to fill out a 2-page form, which only takes about 10 minutes. And then you send the form with your invoice to Arwein DGC for payment. So once we've registered our client, how can we approach planning an equine health clinic? Well, a good start might be to use any existing data which you might hold for that client. So that could be past clinical records or lab results, which you could take with you as a conversation starter. The Welsh Government have a few things that they would like you to get into the discussion. These are health planning, biosecurity, and some discussion around the idea of responsible use of antibiotics. Other than those 3 things, you can use the time however you see fit to discuss whatever you think are the appropriate important preventive health measures for your client. As well as advice, you can use some of the funding to fund antibiotic culture and sensitivity testing. If you see a horse while you're on the visit which might need antibiotics and you take a sample, that can be sent for culture, and you can also claim that fee within the £250. So, how can we start a conversation around health planning with our client? Well, health plans might be a newish concept for equine vets, although they have been a mainstay of farm practice for some years. And one approach which has been successful in the farm sector is to identify 3 areas for improvement that you and your client agree on, and then to focus on thinking of some measures you can put in place to improve those 3 areas. And you could even go back in 6 to 12 months to see whether any improvements had been made. Introducing the concept of health planning into your practice can also be a good way to move away from relying on medicine sales and procedural fees for practice revenue towards a model of selling your services of knowledge and advice as a vet. Advice on preventive routine equine health can all be included in the clinics, and we hope that you would include that, such as worming, vaccination strategy, nutrition and dentistry. Specific health problems could also be discussed by identifying recurring themes on that particular premises and then deciding how best to prevent them in the future. For example, have you seen multiple traumatic wounds on a particular yard, or colics, or cases of respiratory disease? and devising ways in which you might be able to prevent those happening in the future. You could also look at more yard-specific management issues, such as horse fitness or foal management, depending on the type of yard. Cellulitis from wounds accounts for quite a large proportion of antibiotic usage in equine practice. So if you're seeing multiple cases of cellulitis on a particular yard, that could be an area where you could put some measures in place, such as discussing primary wound care with your client and how they should initially clean and dress a wound before it's been seen, and perhaps suggesting early veterinary intervention and thorough debridement rather than waiting a couple of days for a superficial wound and then asking your vet for antibiotics when cellulitis has already set in. Some vets have said that they don't feel they can justify the use of £250 for some health plan visits, and perhaps that might be if you've got a single horse owner. So feel free to use less of the funding if you'd rather do a shorter visit. For example, some vets have used £100 and done a short visit for some clients. It's there to be used in whatever way you wish to. The second topic that we need to cover in our equine health clinic is biosecurity. So many of our clients could probably do with some enhanced biosecurity measures on their yards, and as we all know, the movement of horses between yards is responsible for a high proportion of cases of infectious respiratory disease in horses. So you could use the health clinic as an opportunity to talk about putting some isolation measures in place and a quarantine period, and also not just for incoming horses, but obviously we also need to isolate horses which are showing signs of disease. So we could discuss measures like isolating the first horse that has a nasal discharge or a cough, and doing barrier nursing and temperature checks, and actually helping to stop the spread of the outbreak at the beginning. One of the main factors often in reluctance to isolate moving horses on busy competition and livery yards is the frequency of horse movements. So in these situations, perhaps there are other measures that we could discuss which might also help reduce the incidence of infectious disease, such as keeping those horses which are moving frequently to competitions in one yard group and not having them in contact with vulnerable young stock or aged horses. Also keeping consistent turnout and stabling groups and not mixing and matching, and advising owners to minimise contact with other horses when they are at competitions can all help reduce the disease spread within the premises. Other biosecurity measures which could quite easily be put into place on client premises include disinfecting stables between horses. Even disinfecting foaling boxes pre-foaling often doesn't happen and is important. Hand washing, obviously we're all used to doing that for our own COVID protocols and hygiene between horses, but sometimes on the yard when you're busy it doesn't happen. Also, a lot of the other principles that you might use in your own practice, you could transfer to a client's situation equally. The third topic of conversation which we need to fit into our equine health clinic is having a chat about the responsible use of antimicrobials, so more specifically usually antibiotics. Equine clients, particularly ones which may only have one or two horses, are understandably going to be more interested in preventing their horse from getting an infection than perhaps they are in the greater good of reducing the spread of antimicrobial resistance. We could use the analogy of anthelmintic resistance to help communicate the principle, which is something that equine owners are generally pretty familiar with and actually often lead the way themselves in trying to reduce their reliance on wormers. If you think about it, 20 years ago we were in a similar situation with wormers, and now people are happy to avoid using them where possible. So that's where we also want to be with antibiotics. We could also introduce the concept of critically important antibiotics and help to dispel the myth that certain antibiotics are better or stronger than others, by explaining to clients that we have first-line antibiotics which are completely appropriate in many cases, and that we have others which are critically important that we really shouldn't be using without doing culture and sensitivity first. One way that some practices have used to try and stop clients asking for critically important antibiotics, and perhaps to stop ourselves from automatically reaching for them as well, would be to actually store them separately in the practice, rather than in the car, and in some places they're even in a locked cupboard, so you have to make a conscious decision to go and use that particular antibiotic. We all need to start trying to get into the mindset that critical antibiotics such as the fluoroquinolones or the second generation cephalosporins should actually only be used where absolutely necessary, and preferably after culture and sensitivity. This has actually already happened in farm practice, and the use of critical antibiotics is massively reduced, and it's an ongoing process in small animal practice at the moment, so it is achievable, but in equine practice we have some way to go. We're coming to the end of our video, but hopefully there might be 1 or 2 points that you might be able to introduce there into your equine health clinics. But really, the funding's there for you to use as you see fit for the benefit of your clients, and you very much have a free rein to give the appropriate advice that you want to give. Funding for the clinics is available on a first come, first served basis. So the best time to get the ball rolling is now if you want to register some clients on the scheme. I hope that you'll find the scheme constructive, and that your clients will gain some valuable knowledge from these clinics. One approach that some practices have taken up is to start with a client evening and use that to try and generate some interest and register some clients onto the clinics. So thank you very much. If you have any questions, then get in touch with Marielle or Katie at Arweiniad DGC, and I'm sure they'll be able to answer them for you. Thank you.